Let's discuss a topic I really don't like talking about because there's so many layers to it. It's like an onion. You have to peel back multiple layers to get to the root. And there's not one thing that can contribute to mental health. But I'm going to specifically talk about poverty, how it affects your mental health and physical health. In this video, I will be discussing poverty and how it affects mental health and physical health. Because a large part of brain formation occurs very early within the first 6 years of life. Neurocognitive impacts for children of poverty and neglect. The conditions a child faces growing up can impact the state of the brain years later. Research has shown that poverty may pose challenges to both physical and mental health. For instance, those who live in poverty have shorter life expectancies and experience higher death rates. They may have to engage in more risk-taking behavior in order to get their needs met, putting them at risk of injury and death. I'll be back. Studies also show that poverty in the earliest years of childhood may be more harmful than poverty later in childhood, Garcia Cole said. Garcia goes on to cite studies from scientists like developmental researchers Greg Duncan of University of California, Irvine, and Catherine Magnuson, University of Wisconsin-Madison, who have found the first 5 years of life to be the most sensitive period for the damaging influences of economic deprivation. Duncan's research, for example, has shown that low family income is more associated with difficult circumstances in adulthood when it occurs before age 5 as opposed to later in childhood. Welcome back, those who are returning. Hello to those who are new and stumbled across this page. I'm sure it was not by accident. Hey, let's get into this topic that needs to, I was just thinking about, what drew my attention to this? I mean, I'm always thinking about the conditions of the Black community and, the roots behind the conditions of the Black community. And I can't remember what drew my attention to it recently, but I had planned to do a video on this topic anyway. Poverty, how it affects the mentality. And I say often how a lot of people in the Black community have a hopelessness. They feel hopeless. And when you feel hopeless, that brings despair. And it also causes you to have an F it mentality. Like, you don't give a F. It ain't my community, so why should I take care of it? Or, they feel lowly about themselves, like nobody care about them. And so, how does a person act when they know they're not cared about? Okay, let's get on into this. Poverty as a social detriment of health is a narrowly defined examination that is not intended to be exhaustive and may not address all dimensions of the issue. The United States measures poverty based on how an individual's or family's income compares to a set federal threshold. Example, in 2021, people are considered impoverished if their individual income is below $12,880, or their household income is below $26,500 for a family of 4.2. After 5 consecutive years in decline, the U.S. poverty rate increased to 11.4% in 2020, or a total of 37.2 million people. Poverty often occurs in concentrated areas and endures for long periods of time. Some communities, such as certain racial and ethnic groups, people living in rural areas, and people with disabilities, have a higher risk of poverty for a myriad of factors that extend beyond individual control. For example, institutional racism and discrimination contribute to unequal social and economic opportunities. Residents of impoverished communities often have reduced access to resources that are needed to support a healthy quality of life, such as stable housing, healthy foods, and safe neighborhoods. Poverty can also limit access to educational and employment opportunities, which further contributes to income equality or inequality and perpetuates cyclical effects of poverty. And as I said in the last video I did, no, was it a short? I was talking about how when a community has unlimited resources, there is nothing you really can't do. I mean, in a positive way. If you have resources, like when you're in high school, you have resources where corporations allow you to come and they have apprentice programs. You have sole proprietors that come in and give free training, and you just have a plethora of resources made available to you. There are so many things you can do, you see in your future. But when you live in a community that has to damn near beg and plead for resources, you see the difference? Go to a school that's in a community that has unlimited resources. Not just from the school board, but like I said, from corporations and sole proprietors and donators, people who just want to donate just because. And then go to a community that doesn't have that. Let's continue. Poverty contributes to hundreds of thousands of American deaths a year, a recent study finds. We need a whole new scientific agenda on poverty and mortality, said David Brady, a professor of public policy at the University of California, Riverside, whose recent co-authored study aims to jumpstart that agenda by asking just how many Americans die from poverty each year. It's well established that poverty is bad for your health. But as a public health issue, the U.S. knows less about the direct link between poverty and death than we know about, say, the link between smoking and death. Current estimates suggest smoking kills 480,000 Americans per year. Obesity kills 280,000, and drug overdoses claim 106,000 American lives in 2021. Together, risk factors and their mortality estimates help motivate public health campaigns and government-funded efforts to save lives. But how many Americans does poverty actually kill? The question has received little attention compared to other mortality risks, and meanwhile, poverty remains prevalent across the country. Brady, alongside sociologist Hugh Zing at Ohio State University and Ulrich Cole, a professor of empirical social research at the University of Potsdam, published their study in April in Journal of the American Medical Association. Their results find poverty is America's fourth leading risk factor for death, behind only heart disease, cancer, and smoking. A single year of poverty defined relatively in the study as having less than 50% of the U.S. median household income is associated with 183,000 American deaths per year. Being in cumulative poverty or 10 years or more of uninterrupted poverty is associated with 295,000 annual deaths. Amelia Horaker, a health scientist administrator at the National Institute of Aging, explains that research has shown a variety of pathways that connect poverty and mortality. These range from neighborhood amenities and nutrition down to the impacts of stress on the body. Being poor is really stressful, which we know from NIH-supported research has implications for what's actually happening in the body at the cellular level, which ultimately impacts health and mortality, she said. Crucially, that doesn't mean you'll find poverty written as the cause of anyone's death certificate. Risk factors are only correlations that imply an association, but not necessarily causation. Although new research found that cash transfers to women in low and middle income countries cut mortality rates by 20%. But proving an association is a necessary step towards deciphering whether poverty might be more than an association. For example, there is an association between the number of Nicolas Cage movies released and the number of people who drown in swimming pools that year. No one is arguing that we should dissuade Cage from releasing films in order to combat drowning, but there is also an association between cigarette smoking and lung cancer. Here we do believe one caused the other, so we do try and dissuade people from smoking to combat lung cancer deaths. Arguing that poverty is more like the latter elevates the debate from a statistic squabble to one of literal life and death. We just let all these people die from poverty each year, Brady said. What motivated me to think about it in the comparison to homicide or other cause of death in America is that people would have to agree that poverty is important if it's actually associated with anywhere near this quantity of life. Without a number attached to the relationship, presenting poverty as a serious public health risk falls a little flat. Poverty and mortality are tightly correlated. Isn't exactly as galvanizing a message as poverty kills nearly 200,000 Americans a year. But the key question is what it means to die from poverty. As a social detriment of health, the government already recognizes a direct line between economic conditions and health outcomes. Physicians are now going a step further, establishing a movement known as anti-poverty medicine that aims not only to identify poverty as a health risk, but develop treatments. Attaching a death toll contributes a new data point, perhaps even a rallying point to illuminate the ties between poverty and death, and just maybe it will motivate more urgent anti-poverty agenda on the grounds that it could save lives. Measured in relative terms, poverty in the U.S. is significantly worse than in similarly wealthy countries. Meanwhile, U.S. citizens face a higher mortality rate at almost every age than residents' supplemental poverty measure. At every age than residents of peer countries, and that disparity is growing. Even according to the U.S. Census Bureau's supplemental poverty measure, an approach that tries to blend relative methods with absolute one while accounting for government programs like SNAP benefits and tax credits. Nearly 26 million Americans remained in poverty in 2021. Brady, Zing, and Kohler analyzed data from 1997 to 2019, drawing from the panel study of income dynamics and a cross-national equivalent file. Since the data ends before the COVID-19 pandemic began and poverty likely compounded pandemic's death toll, they believe their findings are conservative. In 2019, being in poverty was 10 times more of a mortality risk than murder, 4.7 times more than firearms, and 2.6 times as deadly as drug overdoses. I said that in the video. I think the video I did talking about who were the true addicts when crack was came on the scene, I think I said I ascertained that poverty was worse than drugs. Let's continue. Think about it. Why people become drug dealers? Did they just wake up one morning and say, you know what? I want to try a new career. Let me go into drug dealing. Or did they wake up and say, I'm tired of starving. I'm tired of going to bed hungry. I'm tired of seeing my siblings hungry. I'm tired of seeing my parents and hearing my parents arguing over money. I'm tired of living in this ish hole, slums. I'm tired of it. And they went out and unfortunately went out to sell dope. And poor people die younger than others. Their mortality rates began diverging from the rest around 40. Around age 40, reaching a peak disparity near 70 and converging back with the rest around 90. The study used a Cox model, a type of statistical analysis commonly used in medical research to isolate the effects of a given variable, often particular drugs, but in this case, poverty, on how long patients survive. But no matter how you analyze it, singling out annual deaths across an entire country from a fuzzy cause like poverty is a statistical nightmare. It's difficult to imagine how one could untangle all the confounding factors like the reverse effect of how poor health also affects income to deliver a plausible number. One of the few previous efforts came from a group of epidemiologists in 2011 who estimated poverty's death toll at 133 per year. 133,000 per year, and while few prior studies aimed to directly estimate deaths attributable to social factors, there is a decades-long history of wrangling statistical complexities to frame poverty as an actual cause of death. Brady cited a famous 1995 paper by sociologists Bruce Link and Joe Flynn, making the case that over and above mere risk factors, social conditions like poverty should be seen as fundamental causes of disease that put you at risk for more proximate risks like heart disease. Link and Flynn's paper argue that if you break down a fundamental cause of disease into its more tractable cause of death, like breaking the mortality risk of poverty down into a cocktail of heart disease, lung cancer, and drug overdose, fundamental causes like poverty get ousted from the picture. Treating individual risk factors alone leaves the underlying social condition intact, and it will continue putting people at risk of other risk factors. Rather than tracing all the different pathways that lead from poverty to mortality and focusing public health inspiring anti-poverty efforts on each one separately, Link and Flynn urged an approach that stays with poverty. If we wish to alter the effects of these potent detriments of disease, we must do so by directly intervening in ways that change the social conditions themselves, they write. Nearly 3 decades later, clinicians are putting these ideas into practice. While the use of social detriments of health as a framework is gaining significant traction among physicians and companies and even the WHO, Lucy Marcel, a pediatrician and associate director for economic mobility in the Center for the Urban Child and Healthy Family at Boston Medical Center, feels they don't go far enough. She helped coin the idea of anti-poverty medicine in 2021. She explained that anti-poverty medicine is one step further upstream to the root cause. Social detriments of health are important, but getting someone access to a food pantry doesn't really address why they're hungry in the first place. It brings to mind that saying, you could either give somebody some fish or teach them how to fish. So even I'm not against food pantries. Matter of fact, I'm for sure I'm not. I'm not going to tell my ideas or business, not right now. But, Food pantries are very helpful to the community, especially those who are deprived. But it's not helping the root of the problem. I started this work about a decade ago, Marcel told Vox. At the time, there was a lot of confusion when I say that I try to get more people tax credits because it helps their health. Now, it's pretty well established at most major academic medical centers that trying to alleviate economic inequities is an important part of trying to promote health. And I can add to what she's saying. Having more money at your disposal does ease the mind. When you have excess money, when you have money to take care of your financial obligations, and then you have money, disposable income, it brings peace. It eliminates a lot of stress and worry about your finances. That's why you can see people walk around so carefree, and they don't want to admit it, but a lot of people walk around carefree because they have disposable income. I don't care if it's a couple of $1,000s. If you done paid the majority of your financial obligations and you have $2,000 sitting aside for, recreational reasons, just in case of emergency, and you have that there to help you, that brings ease and peace of mind. Let's continue. Putting a number on poverty's death count could help build the case for anti-poverty programs embedded within systems of clinical care, like free tax preparation offered in healthcare systems that already have the community's trust, an initiative Marcel pioneered. If I'm able to say to a funder or to a health system, look, it's been published in a reputable journal that there are X number of deaths in our country every year due to poverty, I have a much stronger case for why they should pay for anti-poverty programs, she said. But physicians can only go so far upstream of poverty. Even before the study positioned long-term poverty as a greater mortality risk than obesity or dementia, public health scholars have been arguing that anti-poverty efforts should play a central role in a national agenda for public health. And they should start having medical doctors screen people about poverty and their mental health. And they're going to see how many people's health and mental health is affected by poverty. It should be required for medical doctors to screen a person's mental health and see whether it's directly connected to poverty. Let's continue. Public health campaigns against poverty face a strange and difficult landscape. One thing Americans seem to dislike more than poverty is welfare. Although 82% of Americans reported dissatisfaction with efforts to reduce poverty and homelessness in 2021, in a 2021 Gallup poll, only 40% in 2019. In a 2019 Pew Research Center survey felt the government should provide more aid to those in need. Only 40%. Wow. And I bet you those 40%, those 60% who didn't feel the government should give more aid, they're either racist, rich, or don't give a F, or all three. And what's so funny, a lot of racists come against welfare and blame black people and other people of color about welfare, saying that they're draining the system or lazy and relying on the system. If they only took the time to do some sincere research, they would see that the majority of welfare goes to those called white. It's a fact. All you got to do is look it up. They don't want to look it up because they want to spout these unfactual, unfounded, racist ideologies and propaganda. When we come out and talk about racism and how it affects our community, facts, they want to say we have a victim mentality. or they want to say move on. But they don't want to address the true issues in their community, that they have been given so much that they don't even appreciate it. But then when something else is there's a proposal for other groups to be taken care of or to be recompensed or get reparations, they have an issue with it. Let's continue. Even after President Joe Biden's temporary expansion to the child tax credit nearly cut child poverty in half and showed no signs of fostering welfare dependencies among recipients, critics were unmoved. The policy expired at the end of 2021. 3.7 million American children fell back into poverty, and we've yet to see the program return. Meanwhile, as The Atlantic's Derek Thompson writes, a typical American baby is about 1.8 times more likely to die in her first year than the average infant from a group of similarly rich countries. The child poverty is a major risk factor in all manners of infant mortality. At the federal level, another reason to qualify poverty's death toll could be to add mortality estimates to the cost-benefit analysis that groups like Congressional Budget Office use to score policies and their impacts, telling Americans that the expanded CTC almost single-handedly reduced child poverty by half hasn't yet proved compelling enough to make the changes permanent. If the CBO were to include in their cost estimates that the expanded CTC would save a certain number of American lives per year, or conversely, that letting it expire would cost a certain number of American deaths, maybe the policy discourse will move more urgently. Finding strategies to help support policy implementations is crucial because ultimately treating poverty as a public health issue will require a stronger welfare state that benefits low-income Americans. No country in the history of capitalist democracies has ever accomplished substantially low poverty without an above-average welfare state, Brady said. And so until you get serious about expanding the welfare state in all its forms, you're not serious about reducing poverty. Relative to similarly rich countries, the U.S. has high poverty rates, high mortality rates, and a confusing welfare state. It has the second largest welfare state in the world if you include things like subsidies for employer-based health insurance, tax-favored retirement accounts, and homeowner subsidies. These mostly benefit those who are already well off. Instead, if you judge the American safety net based on the share of GDP spent on programs that benefit low-income citizens, it falls well below the average among other rich nations. In other words, poverty is a policy choice, and the U.S. has yet to choose otherwise, as the sociologist Matthew Desmond put it in his recent call for poverty abolitionism. Ending poverty in America will require both short and long-term solutions, strategies that stem the bleeding now alongside more enduring interventions that target the disease and don't just treat the symptoms. Starters, the U.S. could revive the expanded CTC and make it permanent, or even combine it with the Earned Income Tax Credit into a universal child allowance that would cut child poverty by 64% and reduce deep child poverty by 70%. Child poverty is one of the largest contributing factors to overall poverty in America. The biggest movers in the welfare state are pensions and health care, so invest in those as anti-poverty policies. Brady recommends universal pensions and extending catastrophic coverage. Healthcare to all are a few options. The U.S. could also directly provide homes for the more than 1 million Americans who experience homelessness in the course of a year. The U.S. can do a whole lot to eliminate a whole lot, and we see that with our own eyes when illegal immigrants come over here and get literally banks of money and resources that the average citizens aren't getting. And if you ask for help, financial help, you have to go through your whole lineage to prove why you need help. It's so backwards in this country. Let's continue. If it wanted to go big, it could implement a guaranteed income pegged to the poverty line that would eliminate poverty outright, like the 2021 proposal from scholars at the New Schools Institute on Race and Political Economy. They estimate such a plan will cost $876 billion per year. That's on par with the annual cost of Medicare, which sat around $900 billion in 2021. Meanwhile, one 2018 estimate places the annual cost of childhood poverty alone at $1.3 trillion per year. A federal policy with a universal cash transfer could be relatively adequate on its own if there weren't barriers to receiving it, Marcel said. She's seen firsthand how the implementation of social policy often means jumping through administrative hoops and abominably complex paperwork, with the result that the aid often fails to reach the most vulnerable populations. In her clinic, they help patients who have just given birth apply for Massachusetts paid parental leave program. That's what I just said. That we see what America can do if it wanted to by what it's doing with the illegal immigrants who didn't pay anything into this country. People who cross this border illegally and who are not citizens. More resources than any citizen. Black, white, Asian, and you know more than they have ever done to help black people. And like I said, the programs that they enacted for black people eventually ends up helping everybody. So there's nothing specifically for us. But if America wanted to eliminate a lot of poverty, it could. But the ones on the top, they love dangling carrots in your face, because you realize the ones who hold the purse strings tell people what to do, or try to tell people what to do. People who lack money or disposable income are easily controlled and told what to do. So there's a certain group in this country who loves telling people what to do and getting them to do the dirty work. Let's continue. If you want something eliminated, or you want a problem eliminated from your life, what you do? Go to someone who is in need or desperate to do your dirty work. So if you take people out of poverty, you're not going to be able to control people. Let's continue. Otherwise, Marcel estimates only 1/3 of those eligible successfully navigate the bureaucratic gauntlet to claim the benefits. Most of those who get left out are low-income Americans on Medicaid who identify as Black or Hispanic. In my experience, Marcel said, most social policies are written in ways that make it challenging for those who have been historically marginalized to access them. While big picture death toll estimates may help bolster the overall motivation for anti-poverty medicine, Marcel argues that data on specific interventions is also crucial to justify the expenditure against the array of alternatives, because then you can go to a policymaker and say, look, someone got paid leave and they were less likely to show up in an emergency room than this other family who didn't get paid leave, she said. So it would save Medicaid money to help poor people get access to paid parental leave. Objections to a new agenda on poverty and mortality will range from moral, unconditional aid undermines the American work ethic, to budgetary, how do you choose between giving nurses a raise or funding an on-site food pantry for food insecure patients, but as Brady's new paper helps establish, the scope of the problem is vast, as is the cost in terms of American lives of continuing to treat symptoms of poverty while skimming on treatments for the fundamental cause. I just want to end it on this, and receive it or you don't have to receive it. I'm not trying to force anything on people. I'm just trying to give you another way to look at this. The Bible teaches us that our thoughts and beliefs have the power to shape our lives. Proverbs 23:7, Matthew 12:34. A poverty mentality is rooted in negative thoughts and beliefs that focus on lack, scarcity, and limitations. This mindset is contrary to God's promises of abundance, provision, and blessings. John 10:10 and Philippians 4:19. So, I do believe, I know there's an issue. Poverty will never leave. It's not going anywhere. But that doesn't mean you can't help those who are in need. And it's not just poverty, it's not just a physical thing. It's a mental thing and it's a spiritual thing. And this world and this country focuses only on the physical, and the spiritual is neglected. So it's like the saying, you can take a pig, you can dress him up, you can bathe him, dress him up, and then it's going to go right back to the filth. So if you don't deal with the root, the root of the issue, and it's a spiritual thing as well, it's not going to do any good, put it that way. But thank you. I'm about to close this up. Thank you for your time and attention. Thank you for your support, liking, commenting, subscribing, and sharing. And I will see you in the next video.